Thank you so much for having me. It's a real pleasure to be here and to tell you the HelloBetter story and how we managed to bring our research on digital mental health interventions into reimbursement. Mental health disorders are on the rise globally. About 10% of the global population are affected with a mental health disorder. And during COVID time, this number even rose to an astonishing 28%. However, in the best healthcare systems in the world, around 60% of people with a mental health disorder remain undiagnosed. And only 10% really receive specialist care, for example, from a psychotherapist or a psychiatrist. The waiting times for healthcare, specialized healthcare in mental health are long. In Germany, around 5 months. So this is a very long time when people have to wait for help. However, that doesn't really explain it all. Why are 60% undiagnosed? So when we ask people for the reasons why they do not access mental health care offers, even if they're available, the number one reason is that they prefer to solve their problems by themselves. They also prefer to speak to friends. They feel ashamed. There's still the stigma around mental health. And this is why they do not access treatment. Digital interventions can be a solution here. They allow people to really work on their problems privately in their own space without having to feel uncomfortable about opening up to someone. And we've seen clinical studies on digital mental health interventions around 15 years ago already in countries like the Netherlands, Sweden, Australia, and we have also observed that they work. However, in Germany, Austria, that wasn't possible. Like there were no clinical studies at that time. And this is what we wanted to change. So before we founded HelloBetter, in 2011, we started off with a research project at the Leuphana University in Lüneburg. For all you wondering where that is very close to Hamburg. And we started off developing these interventions. We wanted to really know, can this work? I was skeptical myself, but I was very fascinated by that topic. And we spent a couple of years researching, finding out how we can really deliver these interventions. And then we've conducted research studies, randomized clinical trials, and we've seen it can work. And once the research project is over, we just didn't want to stop there. So we created the structures to really be able to implement these really effective programs in routine care. And this is when HelloBetter was born in 2015 as a university spin-off. Ever since, we've grown from around 3 employees to just over 100 now. And we offer digital mental health programs for 8 different mental health conditions. We've helped around 40,000 individuals to improve their well-being and conducted, since 2011, over 30 randomized controlled trials. Let me show you how this works. What is it, a digital mental health interventions? This is how we approach the topic. So there are various stages that people go through in our programs. It's not just a mental health app, a wellness app. It's really an intensive treatment program. And we know how important it is to take people by the hand, to provide them structures in a situation that is very difficult. So people go through various stages in our programs. They come into the program, they reflect, first of all. What is the situation? What is it that is bothering me? What is it that I want to change? We include a lot of motivational exercises. And then they learn therapeutic techniques that we know work. However, we translated that into a digital world. It's not just putting a self-help book online. It is really finding out how we can deliver cognitive behavior therapy in a way that engages people, that they can really work with the program. And we use psychoeducation delivered, for example, by expert videos, audios, but we also provide interactive exercises. once they leave the session, we help them to implement what they have learned in the program in their daily lives. That can be, for example, by a mobile app companion, and they are, through the entire process, accompanied by real psychologists. So these psychologists, after each session, provide a semi-automated written feedback to ensure that the patients are safe, they read everything that they have written, and really accompany them in the process. We usually use desktop-based programs because these courses are very intense. It takes some time to sit down and really work through it, but we also use a mobile app companion where people can access, for example, an online mood diary. They can access all the therapeutic techniques as part of a toolbox in their daily lives, so they can really practice it, or they can plan positive activities. When it comes to effectiveness, I've brought you here the results of our most, I would say, popular course. And what you can see here in green is a statistical indicator on the effect size. So an effect size of 1 means this is a large effect. And when you compare this to traditional psychotherapy, face-to-face psychotherapy in this area, we see that we have similar effects. It is not a head-to-head trial, so these results are separate, but it shows you what is possible in this area. And we've spent a lot of years researching what works, because there are a lot of things out there that, are maybe not as evidence-based, and what we've seen in a meta-analysis on online digital stress management programs is that we can achieve double the effect size what you would normally see. We've included in our development patients, and we've done a lot of user research, included them, and tried to figure out what works. And it is very encouraging that 90% of our clients would actually recommend us. Also, a consumer organization in Germany, Stiftung Warentest, has named us as a 2x winner of 2 of our programs, Depression and Panic, which is also something that really shows that we are on the right track here. This all would not have been possible without an outstanding team. We have a lot of scientific researchers who have received themselves numerous awards for their expertise. And we've very early on, even before we started the company, had cooperations as part of the research project with health insurance companies who did the study recruitment for us. And ever since, our B2B clients rose consistently. And there are some well-known brands in there. And yes, this is something that has worked out over time, and it was a very good decision to really start to incorporate these health insurance companies from the start. In terms of business models, we focus on 3 areas. So standard of care, getting reimbursement from public health insurance companies, but also the corporate health area, so to include the programs as part of occupational health management, and the therapeutics as a service, where our clients themselves, the therapists and physicians, use the programs to provide the care to their patients. The Digital Care Act in Germany was really a game changer for us. It allowed us to offer our digital interventions to people, and it is being reimbursed by public health insurance. We have so far implemented 5 of our DIGAs in the last 8 months. So it is diabetes and depression, a therapy for depression and diabetes patients. We have chronic pain, stress and burnout, vaginismus, which is a female sexual health disorder, and panic. This brings me to the end of my presentation. I think for us, the Digital Care Act was really a milestone as a company, but I think more importantly for the people themselves, who now have the opportunity to access these interventions free of charge. Thank you.